Hi, I'm Karun. I'm a second-year hem-onc fellow at Moffitt Cancer Center. And today here at ASH, I'm presenting a poster where we looked at the real-world outcomes of talquetamab in relapsed refractory multiple myeloma patients who were treated at Moffitt Cancer Center between November of 2023 till June of 2025. So talquetamab, it's a bispecific antibody which is targeting GPRC5D. That's a specific target. And it's already FDA approved, but the real world data is still building up, and that's what I'm presenting here. We looked at 87 patients with relapsed refractory multiple myeloma treated at Moffitt Cancer Center. While analyzing the survival outcome data, we censored the patients who were bridged with talquetamab so that this data only shows patients who got primarily talquetamab as a therapy. So talking about the baseline characteristics here, we had a pretty high percentage of patients with high-risk cytogenetics, as much as 74%, and 53% had prior CAR-T, 33% had prior bispecific antibody, and 36% received it just as bridging therapy, which we censored, like I mentioned earlier. Overall response rate we saw in 79% of the patients with median PFS of 8.4 months. And median overall survival was not reached at follow-up of 10 months. We found that with multivariate analysis that high-risk cytogenetics and prior bispecific therapies were associated with worse survival outcomes with PFS, overall survival, as well as overall response rate. Now, in terms of toxicity, the most common toxicity is oral toxicity, which is kind of annoying with talquetamab. We saw that 23% of the patients had grade 2 or more CRS, and only 9% had grade 2 or more ICANS. One thing that we did extra compared to the monumental trial, which led to the approval of this talquetamab, was we gave prophylactic tocilizumab to all the patients who got treated on outpatient basis, and none of those patients had grade 2 or higher ICANS or CRS, which tells us that tocilizumab prophylaxis is pretty effective at preventing these serious adverse effects. Else than that, rest of our survival outcomes were pretty much similar to the monumental trial, and the next step for talquetamab will be to figure out the optimal dosing and timing of the therapy. Thank you.